Angioedema leads to inflammation and swelling of different parts of the body. It leads to a rapid onset generalized swelling of the face, the limbs, and the genitalia. And in the intestine, it leads to swelling of the intestine, which leads to colicky abdominal pain and vomiting and diarrhea. And also, it can lead to life threatening laryngeal edema, which can cause laryngospasm and sudden death of the patient. We have to always differentiate angioedema from urticaria, because in angioedema there is no external sign of urticaria, and also there is no pruritus of the skin. Angioedema is of two types: hereditary angioedema or acquired angioedema. Hereditary is an autosomal dominant form and presents usually in late childhood. So, in both these conditions, there is some kind of defect in C1 inhibitor, either deficiency, dysfunction, or destruction. So, which leads to increase in level of substrates, which leads to angioedema. The normal pathway is like there is a substrate known as kallikrein. Kallikrein converts kininogen to bradykinin. And kallikrein also leads to plasminogen to plasmin, fibrin to fibrin split products, and C1 to activated C1, which leads to C2b. So, as the C1 esterase inhibits the first step in kininogen bradykinin formation and the last step in C1 activation, which doesn't lead to the formation of C2b and bradykinin. But in patients with C1 esterase deficiency, both these C2b and bradykinin are elevated, which leads to angioedema. Episodes usually can occur after an infection, dental procedure, or trauma. So the interesting thing is the levels of C1q, which is activated, C1q is activated C1, are normal in hereditary. The levels of C1 is normal, C1q, which is activated, is normal in hereditary angioedema, whereas its levels are decreased in acquired angioedema. And the levels of C4 are decreased in hereditary and acquired angioedema. So this is the main difference. So how do we treat this condition? For the treatment of this condition, we can either give C1 inhibitor concentrate from outside, or we can give bradykinin antagonist. Bradykinin antagonist is ICA-ICA-T bunt, or we can also give kallikrein inhibitors. So the kallikrein inhibitor is E-calantide. So three treatments are: first C1 esterase inhibitor concentrate, second is bradykinin antagonist, that is ICA-T bunt, and third is E-calantide. E-calantide is given.